According to the CEO of the Arkansas Heart Hospital, Dr. Bruce Murphy, there's an international observation that heart attacks are declining. He believes patients are probably more concerned about going out and getting coronavirus and are staying home and trying to treat their cardiac issues themselves.
Dr. Murphy, thank you so much for joining me today. We're talking about how you've been seeing a decrease in patients at the Arkansas Heart Hospital, and there's some concern about that because it's believed that there's still heart issues going on. That doesn't stop. Talk to me about what you're thinking behind all of this.
Well, this has been an international observation. It's not just in Little Rock, but it's been observed in Milan, Italy. It's been observed in Madrid. It's been observed in Boston, and it's being observed here. Is that the heart attack rate has gone down as much as 80% during this COVID virus, and the minimum has gone down is like 50% in Milan, whereas it went down 80% in Madrid, and in Boston it's gone down at almost 80% as well. And the reason is that patients are simply not presenting. I mean, that's one of the factors, is that the patient is probably more concerned about catching corona by going to an emergency department than perhaps sweating out what they are interpreting as a mild to moderate problem, and they're self-treating with aspirin or whatever. So that is it's an international observation is what it is.
Well, what is your advice to those people, those patients who are, they might be feeling some signs of some heart issues coming on, but they're scared to go out and thinking that they're going to get coronavirus?
Well, yeah, there actually is, they should come to the ED. They should put on a face mask and come to the ED and get evaluated. Certainly putting it off to let the heart attack have its full damage is certainly not something that we want to do. And certainly they should present because still there's only a small chance of dying from a coronavirus, and we're talking around 2%, whereas from a heart attack that's completely untreated, you can talk about a death rate that may approach 40 to 50%. So please, no, they need to present. They need to come.
You were speaking to me earlier about how there's some connection between some cardiac deaths and COVID-19. What is that connection?
Yeah, it's just been observed that in the patients that have COVID-19, and if you measure in their blood and find a heart enzyme that is elevated in a heart attack, that those patients have a very high chance of dying compared to not having that enzyme in their blood. They have about a 50% chance of dying if that enzyme is elevated in their blood and they're sick with COVID-19. So what has been observed is that there has been an attack on the heart as well as the lungs. So not only do you have the pneumonia with a lungs full of bacteria and virus, but you also have direct damage to the heart muscle, so that the patients are many of the patients that die, at least 20% of the mechanism of death is cardiac rather than pulmonary. So there is this other connection with COVID-19. One, it stopped the poor normal patients with plaques that from coming to get treatment. And number two, if they get COVID-19, then and it attacks their heart, then their chance of dying from COVID-19 is very high.
Remind us again what some of those signs are that we should be paying attention to within our own bodies. If there's something happening, what do we need to listen to before we come in?
Well, the unusual thing is that the two diseases kind of overlap some in their symptoms, and so that the overlap has to do with one, chest pain; number two, shortness of breath; number three, radiation of pain into other areas, whether it be the jaw or into their back or down their arm. And so some of the patients who think they're having a heart attack have presented and actually have tested positive for COVID-19 because of the overlap of symptoms. At the same time, those are the classic symptoms for a heart attack or acute myocardial infarction, or what we call unstable angina, which is just before the heart attack.
Dr. Murphy, is there anything else you would like to say or add about this subject?
Well, we're prepared for not only a surge in the COVID-19 patient, which may occur later this month, but we're also prepared that when this is over, we're probably going to have a surge of cardiac patients that have been self-treating themselves at home that didn't get the diagnosis in a timely fashion. So,
Dr. Murphy, thank you so much for joining me today.
my pleasure. Thank you very much, Chancellor.
According to angioplasty.org, cardiac arrest deaths at home in New York City have increased by 800%.